Welcome back to the Conemaugh Connection. The ratings of TV dramas like Grey's Anatomy and ER show our fascination with the medical field, physicians in particular. But are these television portrayals of resident physicians accurate? What is a resident physician? What's life really like for a new doctor? And is being a doctor something you might consider?
She will come through this.
You don't know that?
People do think that that's exactly what it is, and I think Hollywood puts a little bit of glamour and glitz in everything. And some things are similar, but the majority of the medical information that's on those shows are definitely false. It's not the way it happens in real life.
Dr. Mikey Wilson should know. After 4 years of medical school, she spent the last 3 years in Conemaughn's family practice residency.
People have to have that drive and that energy to get through it, especially on these long call nights and when they're up for 30 hours straight and have a sick patient on the floor. Those are the things you really need to get through those days.
A resident physician is someone that's graduated from 4 years of medical school and is now spending 3 to 5 years focusing on a specialty area. Memorial Medical Center offers 7 accredited residency programs. An emergency medicine residency will begin in 2008. For high school students thinking about a career in medicine, there's the Mentoring in Medicine program. It was created to help area students get a taste of what being a physician is really like. Founded by orthopedic surgeon Dr. Rick Schroeder, Mentoring in Medicine is an intense 10-week experience.
They spend a week at a time with different specialists, internal medicine, pediatrics, general surgery, radiology, pathology, orthopedics.
The competitive program takes only 8 students, 5 pre-med undergrads, and 3 students in their first year of medical school.
They're on board to see what we do, and if that means we have to go in to see an emergency at 11 at night, or if we have to go operate at 3:30 in the morning, we call them and they come in. That's really the only way they're really going to get a flavor of what this is all about.
The hectic schedule was okay with Joe Delick, a Bishop McCourt All-Star, now studying pre-med at Duquesne University.
You can put yourself in their shoes and see, try to picture yourself doing that, and it was an amazing experience. And that's one thing that you really pick up on is how the patient relates to their physician. They definitely trusted Dr. Carney. He has been very experienced in his field, and you could just see that was something that you wanted to be if I became a physician.
In addition to giving students like Joe an outstanding clinical experience, the Mentoring in Medicine program plants a seed.
Quite simply and quite selfishly, it's to get good, talented young people to go off and be trained as physicians and have a chance that they might come back and practice in Johnstown. This is a wonderful community to practice medicine in. The hospital is far and away more sophisticated than many hospitals in towns this size.
You don't know where your path will lead you, but I've always been interested in practicing in Johnstown. I really like it here. I really like the area that I grew up in and the schools that we have.
For those thinking about becoming a physician,
the first 2 years of medical school, I think, were basically the hardest 2 years of my entire life.
But the payoff.
There's nothing better than helping a person and having them thank you or having them call the office and saying, "Oh, she did a great job."
I still think it's the best job in the world. It sounds corny, but there's just not much that people can do in the world that's better than what I do.
1/3 of all of the doctors on Memorial's medical staff trained in one of our 7 residency programs. For more information on the residencies or the Mentoring in Medicine program, log on to www.conemaugh.org. Coming up, many of the critical healthcare jobs happen behind the scenes by people you may never actually meet. More on that just ahead.